If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. Everybody, welcome to another episode of Talking with Dr. Donna. I'm so happy that you kept your appointment tonight. As you know, you have an appointment with the doctor every Thursday at 6:30 p.m. So join me here on Talking with Dr. Donna. I'm your host, Dr. Donna White Carey, and I just am happy that you're here tonight. We have a great topic. We have some great guests. But before we get into that, of course, just a little bit of housekeeping. If you have not already done so, I would really appreciate it if you would go over to YouTube, if you're watching on Facebook or if you're watching in some other way, go over to my YouTube channel and hit subscribe. If you hear anything that was beneficial to you, that you think you can use in your life to help yourself or someone else, please go over to my YouTube channel, hit subscribe, and then hit that bell icon, and you will get notified every single time we go live, which is when? Every Thursday at 6:30 p.m. This is a live show, which means that this gives you an opportunity to interact with our guests, to ask questions, and to get your questions answered about the topic. So make sure that you sign in, say hey to me, hi out there, I see you all. And let me know if you have any questions. Write it in the chat and I will be able to make sure to ask our guests. There's many ways that you can contact me. Make sure you go to all of my handles. You can go find me on Instagram. You can find me on Facebook. Those are my handles. Just, during the week, if you have a question, you have an issue, you have a suggestion for a topic, this is where you can hit me up right there. Okay? As you know, our goal here on Talking with Dr. Donna is to build a network of generational health. That means starting with you right where you are, and every generation below you and every generation above you, we're going to focus in on these 4 pillars of health. And I truly believe that if we focus in on these 4 pillars of health, in every generation, that we can end the cycle of premature death in our community. We do not need to wait until we are in our 30s or 40s or 50s to think about being healthy. We want to start that from birth. And as you'll hear tonight, it is extremely important to start even before birth. So our 4 pillars are spiritual health, emotional and mental health, physical health, and environmental health. We focus in on those 4 pillars. We are going to make an impact on premature death. We want everyone in our community to live long, healthy lives. All right? So thank you so much for being here. There's a couple of quick, shout out months to this month that I want to give. And the first is that this month is National Minority Health Month. And it is really about focusing in on our community. And the theme for this year is giving your community a boost. And we're going to give our community a boost of knowledge and information. You're going to get that tonight to really help make sure our community, again, is as healthy as possible. Also, because of National Minority Health Month, in particular, this week is Black Maternal Health Week of 2022. And that is why I am so excited about my 2 guests that are here this evening. We're going to really talk to us about Black maternal health. Our topic tonight is, why are Black women dying from childbirth? Now, if you've read the news, if you looked at anything online, you know that there is an inequality between Black women who are giving birth and women of other colors who are giving birth in terms of the rate in which they die. And we're going to talk tonight about why that is, some of the theories, some of the facts, And more importantly, what can you do to help make sure that this doesn't happen to you or a loved one? So let me bring on our guests because I'm really excited that they're here, and I want to give you all time to hear what they have to say and to ask any questions. So first, I am going to introduce Jaisha Wren. Hi, Jaisha. Now, these are my colleagues from Highland Hospital. So let me tell you a little bit about Jaisha. So Jaisha is a certified midwife at Highland Hospital. She is the co-founder and co-leader of Beloved Birth Black Centering. You're going to learn about that tonight. And coordinates program development, logistics, and evaluation, which is really important. Her interests are in Black centering, shared decision making with patients and providers, and eliminating racial disparities. She was born in New Orleans, but raised here in Northern California. She earned a bachelor's degree in sociology from UC Santa Cruz and a master's degree in nurse midwifery from UC San Francisco. So, talking with Dr. Donna, say hi to Jaisha and welcome you to the show. Welcome, Jaisha.
Hi, Dr. Donna. Thanks so much for having me.
Thank you for being here. And then I'd like to introduce our second guest, Dr. Kevin Smith. Dr. Smith, I'm going to say this, and I know he's going to be like, oh, really? But I am responsible for you, Dr. Smith, for being in Oakland. Dr. Smith is a minimally invasive gynecologic surgeon and is the chair of the Department of Obstetrics and Gynecology for Alameda Health Systems. That includes Highland Hospital. His interests include reducing racial disparities, mentoring others, and the treatment of fibroids and other conditions that he can treat using minimally invasive surgery. He earned a bachelor's degree from Northwestern University and his medical doctorate degree from the University of Ohio. He completed residency training and specialized fellowship training in minimally invasive gynecologic surgery at Stanford Medical Center. Welcome, Dr. Smith.
Thank you. Happy to be here, Dr. Donna.
Thank you both for being here and really to help us talk about this really important topic and to really help frame it for us about what it is, what is really the issue, and then what can we do about the issue. So I'm going to turn it over to, I'm not sure who's going first, Dr. Smith or Jaisha, but I'll turn it over to you all and you can share with us what you have.
Fantastic. We brought a few slides to help sort of frame our discussion, but really want to make space for the Q&A portion as well. So we can, if you don't mind, move fairly quickly through those. And again, happy Black Maternal Health Week. Dr. Donna, you mentioned the tragic disparities between Black women and other birthing people with respect to maternal death. And though California's death rates with respect to maternal care are increasing, there's still the concern about severe morbidity, the close call. So the call to action is as high as ever. Can you please place the first? I just want to remind that in California, the preterm birth rate among Black women is about 47% higher than the rate among all other women. We also have a higher low birth rate. Next slide. And centering pregnancy is a model of pregnancy you'll hear more about from Jaisha, which is group prenatal care, which has been shown to decrease those rates of both preterm birth and low birth weight baby, the two leading killers of Black infants. At Alameda Health System and Highland Hospital, we've used the model for over 10 years. The other piece of data that's really important and will sort of frame this conversation as well is lots of data now proves that racially concordant care also decreases mortality and morbidity and poor outcomes. Next slide. We are extremely happy that about a year ago, we took this centering model and applied it to a Black with a Black lens, a Black framework, to really capitalize on the benefits of centering in our community where the statistics are the most dire. And all that credit really goes to Jaisha, who's been a force of nature and leading the charge here. And if you go to the next slide, I think she can take it from here.
Okay, can you hear me? Yes?
Yes.
Okay. So, yes, we have created a really innovative adaptation of the centering pregnancy model of group perinatal care. And we've done this because we really believe in the strength and the resilience and the power of Black people to be healthy in pregnancy and have healthy outcomes. We know that we're not seeing these high rates of morbidity and mortality because there's anything wrong with Black women or birthing people. It's simply because of systemic racism and bias. And so we feel that we've really got a moral imperative to really revolutionize how we're providing care and how we're thinking about solutions to address this crisis. We want to be thinking really holistically, really comprehensively, and make sure everything is grounded in anti-racism evidence. So we have created Beloved Birth Black Centering, and it is meant to honor and celebrate Black people, birth, and community. It's meant to lift up community wisdom, voices, experiences, and expertise of Black birthing people. It's meant to be able to acknowledge and activate the power and potential of Black birthing people, and to embrace our families in a village of community support with that group, all to lessen the impact of racism on our perinatal health care experiences and our outcomes. Next slide. So we like to call it a trifecta of evidence-based strategies. You know, we looked across the country to see what is the research saying about what helps us to thrive. And there's really three main things. First of all, it's that centering pregnancy group prenatal care. We know that that helps us have lower risk for preterm birth and low birth weight, more support, more success with breastfeeding, as well as other experiential-based improvements. And then there's that racial concordance piece. So like Dr. Smith was talking about, there's more and more research coming out showing that we have better outcomes when we're able to have healthcare providers that share our lived experience of being Black here in America. And then the third piece is that wraparound support. So, you know, our program participants are not just facing potential bias in the healthcare system, but also all around us, the structural racism piece, systemic racism piece. We know we can see very different preterm birth rates based on zip code. That has a lot to do with, our exposures to toxic stresses in our environments and our access to resources. And so we really want to address those things as well. So we have a lot of wraparound support. Next slide. So our model is midwifery-led, it's team-based, and we just surround our participants with a whole team. Every group's facilitated by a midwife and a family support advocate to provide that clinical care and wraparound support. And then we bring in other folks, you know, as needed. So doulas, lactation specialists, of course, we have our medical assistant staff and obstetricians as needed for any kind of higher risk medical conditions or complications. Next slide. And we call this the gold package of Black love. We think that's the best way to summarize it. And it is truly been a community involved, like I said, comprehensive, holistic kind of package that includes a lot of different supports. Things like produce boxes delivered to people's homes weekly to address food insecurity issues, nutrition, promotion, restaurant prepared meals delivered for 6 weeks postpartum so that we can really support that healing, that recovery, and that nutrition in that period. It also includes things like photo shoots, pregnancy photo shoots to really uplift our participants, and tons of supplies so that they don't have to buy so many things to be ready for baby. Next slide. So we launched October of 2020. We launch a new group every 2 months. So we are constantly enrolling. We have a Beloved Birth Black Centering group for every possible due date. So, definitely get in touch with us if you are pregnant in Alameda County or know somebody who is. And we will be expanding maybe next year. So there's a lot of demand. Next slide. Our program includes 15 online group perinatal visits. And so this is just a little snapshot of what that looks like on Zoom. This is a picture from our very first group. But, because of COVID-19, we not only had to do the Black adaptation of the program that we had planned, but we also had to do the telehealth adaptation. So we are been using an online program home. That's great. And we continue to really thrive in the Zoom environment, but also hope to be moving in person soon. Next slide. So we have asked our participants what the impact of a program like this has been, and we've gotten some really amazing and moving feedback. And so we have a report that can be shared with folks who are interested. And I just have some highlights of that data here. Next slide. So our participants have said that being able to get their prenatal care through this kind of model has supported their family connection and bonding with their partners, with their baby. It's also helped them understand their rights and better advocate for themselves, and also given them access to resources and supplies that help them have a healthier pregnancy, safer pregnancy. Next slide. And that they have felt seen, heard, and respected, and honored and celebrated as a Black woman and birthing person. Next slide. Next slide.
I think that's it, Jaisha. Those are the slides that were sent over. So we can bring Dr. Smith back in. Yes, thank you so much. That is so fascinating. I'm going to just stop for a moment and let everyone clap for what you all have done, because it is amazing. And I remember the fight to get this up and running, and you both have been there and just completely continuing to fight the battle and move it forward and really make sure that this came to life. And I'm so excited to see it. And I just want to applaud you and appreciate you for all of the work that you do for all of the moms who are out there and come in to Highland. So just a reminder to everybody who's watching, if you have a question, put it in the chat, because this is your opportunity to ask questions of a midwife as well as an obstetrician, and to just ask questions about what this topic is about and whatever it is might be on your mind. There's a couple of things that came up for me that I'm going to ask while you both were doing your presentation. And one is, I want to be clear for folks. What do you mean by racial concordant care? What does that mean? And why is that important?
Yeah, so racially concordant care means that the care provider identifies as the same race as the patient. And so they have that shared lived experience of identifying as that race. And that's important because of how much of risk factor racism is in our society, and how much of a part bias and discrimination plays. And so because of that, it really helps as a provider to be able to more deeply understand and identify with those that we're caring for. And on the patient end, we're hearing a lot of demand from patients saying, no, I know about these statistics. I've heard about these preventable complications. I've experienced not feeling heard, not feeling respected, feeling dismissed, in the healthcare system. And I want to, be cared for by somebody that I feel like I can trust, and, may feel like of the community, may feel like an auntie, may feel like somebody that they can see themselves in and their family in. And so we're really at a time with this crisis where that means a lot to people. And so we're responding to that demand, and people are really feeling like they really appreciate being able to have a safe space to come to receive their prenatal care, where they can feel like they're in community and in family.
Awesome. Thank you. Just a couple other questions that I want to just make sure that people understand what you all are talking about. You're using the phrase of of women and birthing people. And I don't want that phrase to be sort of glossed over and missed by our listeners today. What do you mean by including the birthing people? Who are they?
Yeah, definitely. Thank you for asking. So, we are following suit with a lot of folks who are starting to popularize being more inclusive with sexuality, with gender identification, and recognizing that. There are lots of people who are having babies who don't identify as women. While most people, the vast majority of people do, it is growing that people are able to identify and be open about how they're identifying and still be able to pursue creating a family. And so we very passionately, one of our values is just inclusivity. We want to make sure that people understand that as a program, we're all about Black love. Excuse me. So we believe that love is love. People should love who they love, be who they are, and we care for everybody.
All right, I like that.
Most
Yeah, Dr. Smith, there's some questions in the chat about the difference between um, getting care from a doula, getting care from a midwife, and getting care from an obstetrician. So can you sort of, maybe you and Jaisha together can tag team and outline the care between those professionals?
Well, I will say that thank you for the question. And you congratulated both of us. I want to tell you that Jaisha is doing so much of the heavy lifting here. And as you can see, is a powerhouse. So I don't want to steal that shine at all. A doula is trained, not necessarily licensed, medical professional, medical companion or support person that can be very helpful in medical care, especially uh, prenatal visits, labor, postpartum visits, nursing. When you talk about midwives and obstetricians, they are licensed professionals, medical professionals with that appropriate training. There are styles of obstetric care that midwives are best at. There are levels of medical care where an obstetrician needs to come in. There's some basic principles, obviously, along that continuum, and then points along the continuum where expertise from one or the other specialty may come in. I will say that at Highland Hospital, the majority of our deliveries are performed by midwives. We have a very low cesarean section rate, likely the result of the sort of care that midwives provide. Anything you want to add here, Jaisha?
I think you put it very well. I would just say that, what really struck me when I was doing research about, maternal mortality, infant mortality, what we know about the countries that have the best outcomes in the world is that their systems of perinatal care are more integrated and collaborative between the professions, between midwifery and obstetrics, and use those professions as Kevin described. And really, what tends to work the best is having a midwife as your first stop. A midwife is the expert in normal physiological processes of pregnancy and birth, and understanding how to best support those normal physiological processes and to hopefully keep things as normal as possible, but also be able to recognize when things are veering off the path of normal, and becoming very complicated and in need of obstetric care. And so that's really, what's appropriate is to bring obstetricians into the care when needed for those medical complications. And so that's what we see around the world. And that's what I think we in the United States have to learn and can move towards.
Great, thank you. How can someone get enrolled in the Beloved Birth Black Centering Group?
Can I just add one more piece?
Oh, sure.
Sorry.
Yes.
That I wanted to make sure your viewers walked away with from this message. With respect to doulas in particular, having a doula in your obstetric or prenatal care has also been statistically shown, to decrease poor outcomes and morbidities for Black moms and birthing people. And it's critical that that's a part of our regular beloved birth Black centering model. So doulas are very important.
Yes,
Great.
yes.
Yeah.
They're included. So everybody who's in our program wants a doula gets one. We highly encourage them. So many benefits, lower risk of complications and labor and birth, lower need for pain medicines and, lower risk of having those kinds of, I think, bias and discrimination based negative experiences when you've got that kind of advocate there, somebody to help navigate care. And so wonderful supports.
Yeah, I kind of think of a doula as think of it as like your best friend who really cares about you, is looking out for you, not going to let anything happen to you, coming with you to every appointment, and be in the room while you're delivering. But they not only are they your best friend, but they also have some knowledge about what's happening and the healthcare system. So they're not just coming in ready to fight. They have some they have some information and some knowledge to give you as you help to make your decisions as you're going through your birthing journey. And I think for those of you who are in Alameda County, and if you have Alameda Alliance, then they're actually starting to be paid for. So you can actually have a doula, and that is covered by your insurance plan. So check that out if you are in, getting
Or
ready
you
to give
can
birth.
join Beloved Birth and you'll have one.
There you go. So how can they
Provided for
join?
you.
How can they join?
So you can check out our website. You can just search Highland Hospital, Beloved Birth Black Centering, and we have a lot of information there on the website, more details about our program, and there is a tab for enrolling. And so you can to call the number there, just start your prenatal care at Alameda Health System, and whatever visit you have first, your initial intake, or whether you've already started with a provider, just let them know. I want to be involved in Black Centering. They'll go ahead and refer you. So it's pretty simple.
Great. What's the website, Jaisha? Is that for AHS website, or is there a special Beloved Centering website?
Alameda Health System's website. It's under the Family Birthing Center website. And if you just search in the search bar, Highland Hospital, Black Centering, it'll come right up at the top.
Awesome. Okay. And then you mentioned that there is a report. How do you get a copy of the report of the showing and demonstrating the great work that you guys have already done?
Yeah, that's a great question. I can share it with you, and you can share it with your listeners.
Oh, I love that. Okay. Very easy. Okay, let's see if there are any other questions in the chat. I think for the most part, so remember, if you have any questions, this is your opportunity to ask. Do you recommend birth plans?
Definitely. Birth plans are good to have. But I think it's sometimes helpful for people to think of it as birth preferences. And it is super important to be able to be well informed about what are all the decision points in pregnancy and birth, because there actually are a lot.
Yes.
And one of it's really important, especially as Black people, for us to understand as Black women, what our rights are. First of all, that everything is always our choice, right? As healthcare providers, our job is to give you information and to give you recommendations, but we can't make decisions for a person. And so it's really important that our rights are honored. But in order to make decisions, we have to have information to base those decisions on. And so, yeah, the process that we help people go through to make a birth preference, list or a birth plan is really about exploring all the decisions to make. What are the pros and cons, risks, benefits, alternatives? What's your intuition telling you? And then being able to put all that on paper. It's not so important which paper, what it looks like, but just getting your preferences down, and then knowing that we never know how labor will unfold, right? And so sometimes,
Right.
I think birth plans have gotten a little bit of a bad name.
Yeah.
Which is unfortunate, I think, because sometimes people felt like, well, if that's my plan, everything on this plan should happen exactly according to plan, right? But we know that's not actually how it works, because we never know how labor is going to unfold. We never know what, the birthing person is going to need in the moment, or what that baby's going to need during labor. And so it's important for it to be flexible as well. And so people might express, okay, if this happens, I prefer this. If we need a C-section, I prefer the C-section to be this way. It's nice to have some different kinds of flexibility built in.
Great.
And I think it's emblematic of what I would recommend, and we would recommend for Black patients everywhere, and that's some agency and ownership about your care in general. Yes, you have a voice in your care. Use it.
Great. And that actually leads into the next question I was going to ask, which is how can families advocate for themselves or a family member during labor and the birthing process?
That's a great question. I recommend kind of a framework of, we call it brain talk, but being able to practice how to ask those questions so that you can really get the information you need and then really own your decisions and your agency. And when a recommendation, sometimes in healthcare, we as healthcare providers might make a recommendation and not give all the details we could. This tends to happen, I think, also, in a hospital setting where maybe things are moving fast. And maybe, you as a birthing person might not understand everything that's being said. You might have questions, but oftentimes I think people don't feel comfortable asking. And that's a lot on healthcare providers for not creating an environment, right, where people can feel comfortable asking the questions.
Yeah.
I just encourage, Black people, especially because of racism, because of bias, we got to be extra, really strong in our self-advocacy and have those advocates with us and really say, you know what, I hear your recommendation and I want to hear, why it is that you think that's the best plan. What are the risks? What are the alternatives? And then really know your rights and know how to follow up on things when you're feeling disrespected.
Great.
Yeah, I love
You
that
want to add
answer.
to that?
Yeah, I do want to add to that. I agree with everything that Jaisha said, and I think the underlying message or overriding message is advocacy. If your advocacy is enhanced by having someone at your prenatal visits or at whatever medical visit you are, bring them with you. We've talked about racial concordance as a data-proven complication mitigator. So ask for a doctor that you're racially concordant with. Ask for a midwife that you're racially concordant with. Ask for a Black doula. Get second opinions. This is your health, your body, your unborn child or children, and that's where this racial concordance comes in. Just to add to a little bit of what Jaisha mentioned earlier, that data-proven comfort that you have in that concordance space, that data-proven trust that you have in that concordance space, is going to allow you to say what you really need, for your provider to actually elicit from you what you may not know you need. So it's a health advocacy recommendation to look for that concordance.
Great. Thank you. All right. So my final question for both of you, and I'd love for both of you to answer this question, which is, what do you want people to know or remember from what we've talked about tonight? What do you really want them to remember and take away from this conversation? And I'll start with you, Jaisha.
I would say that what I want people to remember is that while the toxic stress of racism, yes, it does increase our risk of complications. It doesn't have to be this way, though. And there are many things that mitigate this risk, that help us to thrive, and that we are perfectly capable of thriving. And so I just want people to remember that and to seek out care that really feels good to them and is anti-racist, and seek out what brings you joy.
Great. Thank you, Jaisha. Dr. Smith.
I would like people to remember that at Alameda Health System, we understand that it's racism, not your race, that is causing these poor outcomes. We understand anxiety about engaging the healthcare system, knowing what we know about all the data, but we are working every day to address it, to recognize it, and to mitigate the risks of the racism. It's overwhelming to really think about all of the disparities that Black people experience and others, but to be in a position to make a tangible difference like this is why we're here.
Oh, I think Dr. Smith froze right in the midst of such a great, words that he was saying. But I heard it, and I hope you all heard it too. That it's racism and not your race that is the problem. Are you back, Dr. Smith?
Yeah, so I was just running my mouth and no one heard it. Is that what happened?
And it was fantastic too.
Well, let's just say I want you to know that we are fighting for you. If you have questions, whether you choose this new innovation or not, we're happy to answer those. And I double checked the website. It's www.alamedahealthsystem.org. And once you're there, you can look up Family Birthing Center and or Black Centering. But we're working every day to mitigate the causes of racism. And this is just really exciting to be a part of.
Great. Thank you both so much. And I lied by saying that was our last question because, of course, as you say, last question, then other questions pop up. So let's see if we can, if you don't mind, answer just the last couple of these questions from the chat. So one is, how important is it to know the health of women in your family as it relates to maternal health?
Extremely. I can start if you want, Jaisha, but definitely there are maternal conditions that need to be addressed that may be familial or passed down, or other conditions that can affect your pregnancy that are passed down. So more information is always smarter.
Great. Jaisha, do you want to add to that, or you think?
Yeah, I agree. I think that, knowledge is power. And if we can know those things early on in the pregnancy, then we can maybe anticipate or know where we need to fortify certain health measures. So that's always good.
Great. All right. And then really the final question, what should someone do if they're in the process of delivering and they feel like, or even if they're in a clinical setting and maybe not in the delivery room, but if they feel like they're being treated differently or unfairly because of their race, what do you suggest for people to do in those situations?
That is a really good question.
Yeah.
My instinct is to call it out.
Mm.
I would call it out. I would stop and exercise my agency.
Mm-hmm. Okay.
Yeah, I'd agree.
Yeah.
And we're big advocates of that, of just having these tough conversations, and really naming the problem. And I think that that's a lot of the work we're doing, at Alameda Health System and Highland Hospital, is not just providing that safe space with Beloved Birth Black Centering, where we have that racial concordance, but also helping to support people to enter into a hospital setting where all different kinds of people they're going to interact with and receive care from people of all different identities, and bias could come into play, whether it's conscious or unconscious. But them being able to feel like there's people who have their back in case they feel like they're being treated differently because of their race. And I think that's really important. We let people know. They've got my cell phone number. I'm like, Kevin, Dr. Smith, he's there. If something goes down, you've got people to call. And that's what there have been times where Kevin has been called upon and done a beautiful job
this week.
Yeah, it's part of our ongoing work, and it's just so important. So yeah, we've really been just really blessed to be able to do this work with all of our colleagues, and to allow our patients to feel safer and more respected.
Yeah, that's probably one of the things that I miss about not being at Highland is really being able to be that face and that advocate for our families, particularly in the NICU space. If there is a baby that's born and having issues, to be able to, walk in and have them look around and see me and like, I know you're going to have my back, right? And yes, so that is one of the things.
You could do a shift a week.
Shut your mouth, Dr. Smith.
I'll let them know tomorrow.
That's okay. Thank you, though. I certainly appreciate your efforts. But as I always talk about on this show, I talk about making sure your doctors are part of your dream team. They are your dream team. And if you can't ask, if you don't feel safe, like to Jaisha said, you should feel safe and comfortable. If you can't ask questions or you feel like you're being brushed off and not being heard, then you have the right and you have the power to say, stop, I would prefer someone else. And I really want you guys, I want to amplify that. That is, let's put that up, Donnell. I want everyone out there to hear that. Let's amplify that to your family members, to your friends, that you have the power and you have the right to stop care from anyone who makes you feel unheard, uneasy, or unseen. All right. Any final thoughts, Jaisha or Dr. Smith, that you want to say before we let you go?
I want to thank Jaisha for the work she's done and for allowing me to be a part of this team. This Monday we had a screening of a film that's now being shown as part of a Smithsonian exhibit in DC here locally, called On the Pulse of Life, which highlights this work. And Jaisha and the panel afterwards with the mothers who are graduates from this program just was overwhelmingly gratifying. They are so happy to have been a part of this kind of prenatal care and true ambassadors, and just nice to see that effect. And I want to thank our team for that, and Jaisha in particular, and the mothers.
Thank you.
Awesome.
Thank you, Dr. Smith. Yeah, it was a beautiful screening. And yeah, that keeps me going, is to hear the impact this is having for our mamas, for our community members. And there were some powerful things they shared there at the screening. We had an older daughter who was able to participate in the making of the film with her mother. And her mother talked about how important that was for her to be able to know that her daughter could see a Black woman filmmaker and could see this whole team doing this work. To understand all the options, all the things that we can be. And one of our mamas talked about, feeling like, for example, being in a community like Oakland, where it's such a rich history of Black activism, going back to Panthers who had health programs in the community and recognized the importance of that. And she was like, I was learning how to take my blood pressure and learning all these things, and it felt like we're continuing that legacy. And so, yeah, it's very special and very heartwarming. And so I appreciate our participants sharing, and we just got to keep it going, keep growing.
Yes. Well, thank you both again for being here. I really appreciate you taking time out of your Thursday evening to be on with us and to share your information and knowledge and share about this great program. So thank you, Jaisha. Thank you, Dr. Smith, for being here. You're welcome back anytime, but thank you. You are now a part of the Generational Health Network. So thank you and welcome to the network. All right. I will talk with you both later. Thank you so much. Now, for you all out there, there's a couple of other things that we need to do tonight. We're going to do our need to knows and introduce our food of the month. So let's start with our need to knows. So this is what you need to know this week of what's going on and where you need to focus in on, pay attention to. So number one need to know, I want you to focus in on coronavirus and our kids. I want you to be paying attention to what's happening around the state and around the country regarding new mandates or dropping of mandates. So there was a bill that was going to go into effect where COVID-19 vaccination was going to be required, just like measles, mumps, and rubella and hepatitis, in order for children to start school. And that bill has gone to the wayside. It is dead. It is not going to happen. Now, why that is important is because for those of you out there who have children in elementary, middle, or high school, that there are going to be other kids in the classroom with your children who may not be vaccinated against this virus. And you as a parent are going to have to make a decision about what you are comfortable with in your child, whether you want your child to wear a mask, to continue to wear a mask or not, to get the vaccine or get a booster or not. So I want to bring this to your attention. We'll continue to talk about it as we continue school, and more importantly, as we come back in the fall, to really think about how to keep your child as safe as possible. We know that Oakland Unified School District is dropping the indoor mask mandate, so children will no longer be required to wear a mask indoors. As you know, we've talked about it here on this show. Do I recommend that your children continue to wear a mask? Absolutely, but this is going to be a personal choice for you and the other children in the classroom. But I want you to be aware, because I want you to hear from Dr. Donna that I still recommend your children wearing a mask indoors, and that we continue to do all of the things that we've been doing to help keep the rate of infection low. Opening up windows, opening up doors, and allowing great ventilation to come in, and really separation between your children. Recommending that we continue to do that despite the masks and despite the vaccination. So that's the number one thing that you need to know this week. Our second that you need to know is around coronavirus and variants. Now, we have had many conversations around variants. And as I hope you all are aware by now, we are going to continue to have variants. Why? Because that's what viruses do. They want to stay alive just like we want them to die. They want to stay alive. They find ways in all of their copies to find some way to stay alive despite a vaccine or despite treatment that you may have had. And so we're going to continue to see variants. So I want you to kind of calm down whenever you see a new variant that's on TV. We're going to continue to see variants. There are always variants out there. Some of the variants they talk about, and some of the variants they don't. So this new variant, which is XE, it's a combination of the Omicron, which was that first variant that we had, and then the Omicron subvariant, right, that we had. They combined together, and now there's this new variant. But that variant is called XE. And the reason that it is an E versus an A is because we've had variant XA, XB, XC, XD, and now we're on XE. So I want you to calm down about variants. We're going to have variations in this virus, but the key is, are those variants strong enough or important enough to impact our health, to actually infect us? So that's the second thing I want you to know, is to relax a little bit when you see on the news about new variants, because they're happening all the time all around us, and you don't hear it all of the time. When you start to hear that they're infecting more people, they're becoming more of the dominant strain, then we'll come and talk about those variants, okay? The number 3 thing that I want you to know, this is Black Maternal Health Week. You've heard us talk with Dr. Smith and with Jaisha about Black maternal health. And the third thing that I want you to know is that the statistics around Black infant mortality or infant death is very much in line with maternal death. Almost 3 to 4 times higher in our Black infants dying before the age of 1 than any other race. Racism is impacting every aspect of our health, in our maternal death rates and in our infant death rates. So I've said this before, if you know someone who has a baby at home, I want you to amplify this, and that is the ABCs of having a baby and keeping them safe. Amplify this, write this down. The ABCs of infant health. A, you always want your baby to sleep alone. And I know in our communities, we often like to have our babies in our beds with us. It's easier when you're breastfeeding and then they go to sleep and they like to be close to you. But it is safest for your baby to sleep alone. That's the A. The B is for your baby to sleep on his or her back. So putting your baby on your back is the safest, not the side, not the stomach. This is at nighttime when everyone in the household is asleep. Of course, during the day, if you want to put your baby on your tummy and you're awake and you're walking around and constantly checking in on the baby, that can be okay. But I want them on their backs for nighttime sleep and naps. And finally, the C is the baby should be sleeping in a crib, right? Not on a couch, not in a chair, not, in any other place except for alone on their back in a crib. The ABCs of trying to help to prevent infant mortality and infant death. Until we work on racism, until we get that eradicated, the best things that we can do now is try to make sure we amplify the message and amplify the education. As we learn it, we teach it to someone else. All right? So those are Dr. Donna's need to know, what you need to know this week. All right, let's talk about our food of the month. You know, here on Talking with Dr. Donna, we're trying to make sure you are healthy in every single way. And we know, I talked about this a couple of weeks ago, that the number one, the highest factor that impacts our health more than anything else is our diet. So we are trying to introduce things to you that will help you in that quest towards health. All right? So our food of the month this month is, drumroll, nuts. Lots and lots of nuts. Nuts are so super healthy. Nuts. I want, my favorite nuts are probably almonds, pistachios, and cashews, and then pecans. But normally I like it on a pecan pie. But we're not having a pecan pie tonight, everyone. We're going to do just nuts. So let's look at some of the benefits that are available to nuts. Now look at that. We've got so many different types of nuts: walnuts, cashews, peanuts, almonds, pistachios, so many different Brazil nuts, so many different things. All of them are a great source of so many nutrients. Lots of them are loaded with antioxidants, and we talked about this many months ago when we talked about making sure that the antioxidants are helping with stopping the formation of the cells to create cancer. They aid in weight loss. They help to lower cholesterol and triglycerides, which leads to atherosclerosis, or can block the lining of your arteries, that can lead to heart attacks and strokes. It helps to decrease type 2 diabetes, reduce inflammation, gives you fiber. Dr. Peterson will be happy with us. Dr. Kim will be happy with us for taking care of our colon. And it reduces your risk of heart attack and stroke. So nuts overall have all of these different benefits. So the nuts that I want you to think about for this week, so every week we're going to try to highlight a different nut, because I want to encourage you to try something maybe that you're not used to trying. So this week we're going to highlight a couple of nuts. We're going to highlight pistachios. I want you to really think about pistachios, one of my favorite nuts. And we want to make sure that these nuts are going to be raw or natural, so not salted, not honey-coated, just the raw nut, okay? And in this nuts with the pistachios, it's going to be really good. I want you to go and look and try to get a bag of pistachios, and they are high, like we said, in all of those things: antioxidants, fiber, decrease in inflammation. They're loaded with all sorts of other benefits and minerals that we need, like potassium and phosphorus and copper. We need these things in our bodies to make our bodies function optimally. Again, helping with the weight loss, giving you something to snack on that's kind of crunchy, and like doing something with your hands, so try some pistachios today. And then the second nut that we're going to highlight today, we're going to highlight pecans, yummy pecans. And so pecans, again, raw, not salted, not honey-coated, just regular old pecans, are so super healthy for you. And if you've ever had like a handful of pecans, you know what happens in about 45 minutes to an hour, right? You're running to the restroom because they're so good to help with fiber, to help keep that colon clean. So this week, I encourage you to try some pistachios and some pecans. You know, put them in some oatmeal, add them to your yogurt. I add them to my yogurt just to give me a little extra protein, a little extra fiber, and kind of help me stay full. I add it to salads. And so I want you this week to interact with us and let us know how you're eating pistachios and pecans this week. Again, you may like pecan pie, but I don't want a recipe with pecan pie in our chat unless it is totally healthy. But good luck with that, okay? So let's try pistachios and pecans for our food of the month. And we'll highlight some other nuts next week, okay? All right. Woo! So much information. I hope you really took notes and thought and listened to tonight. I hope you understand the message that we want you to amplify, which is that you have the power and the authority to be in control of your body when you are in a birthing situation or even when you are in a clinic visit. No matter what you're doing, that doctor should be a part, that doctor, midwife, nurse practitioner should be a part of your dream team. And if they are not, then you have the right to ask for someone else. So thank you once again for listening to Talking with Dr. Donna. Remember, you have an appointment every Thursday at 6:30 p.m. with the doctor. So tune in. If you have not already done so, please go over to YouTube and subscribe to my channel. And thank you, team, for this reminder that tomorrow we have a vaccine clinic from 12 to 4, where you can come and get your initial vaccine or your booster. Remember, if you're over 50, you are qualified for a booster shot for now. So come get it. Come make sure you're protected. All right, until next Thursday, take good care of yourselves and your family, and we'll see you then. If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.